7 worst hiatal hernia symptoms that could be warning you of trouble. Your diaphragm has one job: keep your stomach where it belongs. There's a small opening in it called the hiatus, and your esophagus passes through that opening to connect to your stomach below. When that opening weakens or stretches, your stomach can push upward into your chest cavity. This is a hiatal hernia, and it's far more common than most people realize. Age, obesity, pregnancy, and chronic straining all wear down the tissue holding everything in place. Over time, that wear and tear lets the stomach migrate where it shouldn't be. Doctors classify these hernias into 4 types, but what matters most to you is severity. A small sliding hernia might cause nothing more than occasional heartburn. A large paraesophageal hernia is a different story entirely. When a significant portion of your stomach sits in your chest, it can twist, get compressed, lose blood supply, or even rupture. Today we're covering 7 symptoms tied to severe hiatal hernias. These aren't your average ate too much spicy food symptoms. Some of these can mimic a heart attack. Others can silently damage your lungs over years without you knowing why. And one can become a surgical emergency within hours. We're going deep into the actual mechanisms behind each symptom, not just listing them. Understanding why these things happen in your body is how you recognize when something is seriously wrong. Stick with us through all 7. By the end, you'll know exactly which warning signs demand a doctor's attention right now, not next month. Disclaimer: this video is for educational purposes only and is not intended as medical advice. Always consult a qualified healthcare professional for guidance regarding any medical concerns, diagnoses, or treatment options. All information provided is the result of careful research and verification. For full source details, please refer to the video description. 1. Severe refractory regurgitation and aerodigestive aspiration. Your esophagus is normally protected by a 2-part barrier. The lower esophageal sphincter handles the inside job, while your diaphragm muscle squeezes from the outside. In a hiatal hernia, these 2 structures get pulled apart from each other. That separation devastates the pressure barrier that's supposed to keep stomach contents down where they belong. The result is regurgitation, and this is not the same as vomiting. Vomiting is an active, forceful process your body initiates. Regurgitation is passive. Acidic stomach contents simply flow backward because nothing is stopping them anymore. This becomes dangerous when it happens while you're lying down or asleep. Your airway protective reflexes are weaker during sleep, and that refluxed material can slip into your windpipe instead of staying in your throat. Stomach acid and digestive enzymes touching lung tissue causes immediate, intense irritation. Your airways weren't built to handle that kind of chemical exposure. This is why people with severe hiatal hernias often wake up choking, gasping, or coughing violently at night. Some develop a chronic, unexplained cough that no allergy medication seems to fix. Hoarseness and a constant sore throat are also common, caused by acid repeatedly irritating the vocal cords. Some patients even develop reflux-triggered asthma, where their airways spasm in reaction to the acid exposure. When aspiration happens repeatedly, it can progress to aspiration pneumonia or chemical pneumonitis. These are serious lung infections caused by foreign material settling into the lungs. If you're having unexplained nighttime choking episodes alongside chronic cough or hoarseness, this combination is a major red flag. It often signals the kind of mechanical failure that medication alone won't fix. 2. Non-cardiac chest pain and acid-induced esophageal spasms. This is the symptom that sends people to the emergency room convinced they're having a heart attack. And honestly, that reaction makes complete sense given how it feels. Here's the biological reason for the confusion. Nerve fibers from your heart and your esophagus actually feed into the same area of your spinal cord. Your brain receives pain signals from both organs through nearly identical pathways. So when your esophagus is irritated, your brain can genuinely misread that signal as cardiac pain. There are 2 separate mechanisms driving this chest pain in hiatal hernia patients. The first is chemical. Chronic acid exposure damages the protective lining of your esophagus. That damage exposes sensitive nerve endings directly to stomach acid. This direct contact can trigger powerful, uncoordinated muscle spasms in the esophageal wall. These spasms aren't gentle. They produce a crushing, squeezing chest pain that can radiate into your back, your neck, or even your jaw, exactly like cardiac pain does. The second mechanism is purely mechanical. In larger hernias, a significant chunk of your stomach is physically sitting in your chest cavity. That mass takes up space that's normally reserved for your lungs and other structures. It can press against nerves, irritate the lining around your lungs, and create a persistent sensation of pressure or fullness. This mechanical pressure typically gets worse after eating, since your stomach expands and takes up even more room. Bending over or lying down can intensify it too. If your chest pain consistently shows up after meals or when you bend forward, that's a meaningful clue. It points toward esophageal and mechanical causes rather than your heart, though only a doctor can confirm that safely. 3. Severe mechanical dysphagia and postprandial satiety. Dysphagia simply means difficulty swallowing, but in severe hiatal hernias, this isn't a vague sensation. It's a real, physical obstruction happening inside your chest. There are actually two different problems that can cause this, and they work very differently from each other. The first involves chronic acid damage creating strictures, which are narrowed sections of the esophagus from scar tissue. The second is purely mechanical, and it's specific to larger paraesophageal hernias. As your stomach pushes upward through the diaphragm, it can literally twist and kink on itself. Picture squeezing a garden hose through a small hole and then bending it. Food traveling down your esophagus hits that twisted anatomy and simply gets stuck. Patients frequently describe this as feeling like food is lodged behind their breastbone. It's an uncomfortable, sometimes frightening sensation that doesn't resolve with swallowing harder. There's a second consequence of this anatomical distortion that's less obvious. When part of your stomach is squeezed into your chest, its usable capacity shrinks dramatically. A smaller functional stomach fills up fast. This leads to feeling stuffed after eating only a small amount of food, known as early satiety. Food can also become trapped in this compressed pouch longer than normal, since the outflow path is partially obstructed. This delayed emptying causes ongoing nausea and upper abdominal discomfort long after a meal should have digested. Over time, many patients develop genuine anxiety around eating because every meal brings discomfort. This often leads to reduced food intake and unintentional weight loss. If you're avoiding meals because eating consistently causes pain, fullness, or a sensation of food getting stuck, this isn't something to push through. It's a sign of mechanical obstruction that needs proper imaging to diagnose. 4. Dyspnea and chronic microaspiration-induced pulmonary fibrosis. Difficulty breathing is reported by roughly a third to nearly half of people with large hiatal hernias. This isn't a coincidence, and it isn't anxiety, it's a direct physical consequence of anatomy gone wrong. The mechanical explanation is fairly straightforward. A large stomach sitting in your chest, especially after a meal or when filled with swallowed air, physically pushes against your lungs. Your left lung, in particular, gets squeezed and can't expand fully. Your diaphragm's normal movement also gets restricted, making each breath less efficient than it should be. In extreme cases involving giant hernias, this mass can even press against the heart and major blood vessels. That pressure can reduce how much blood your heart pumps, worsening breathlessness, especially when lying flat. But there's a second, sneakier mechanism happening at a cellular level, and this one develops over years. Tiny droplets of stomach acid can be silently inhaled into your lungs without any coughing or choking sensation. This is called silent microaspiration, and patients have no idea it's happening. Researchers can actually detect pepsin, a stomach enzyme, in lung fluid as proof this process is occurring. Each microscopic exposure injures the delicate cells lining your air sacs. Your body responds to this repeated injury with inflammation and a healing process that, when triggered constantly, goes wrong. Specialized immune cells flood the area and release signaling molecules that tell your lung tissue to lay down scar tissue. Repeated over months and years, this creates progressive lung scarring known as pulmonary fibrosis. This connection isn't theoretical. Hiatal hernias show up in approximately 40% of patients diagnosed with idiopathic pulmonary fibrosis, and their presence is linked to faster disease progression. If you have unexplained breathlessness alongside a known hiatal hernia, this connection deserves serious attention from a pulmonologist. 5. chronic hypochromic microcytic anemia from Cameron lesions. This next symptom is sneaky because it has nothing to do with classic heartburn or chest pain at all. Instead, it shows up as unexplained fatigue, paleness, and shortness of breath during everyday activity. The culprit is something called Cameron lesions, which are linear erosions or ulcers that form on the stomach lining. They appear specifically at the point where the diaphragm pinches the herniated stomach. These lesions show up in roughly 5% of hiatal hernia patients, and they're far more common with hernias larger than 3 centimeters. 3 separate mechanisms work together to create this damage. First, there's mechanical friction. Every time you breathe, your stomach shifts slightly within that tight diaphragmatic opening, rubbing against firm muscular edges with each movement. Second, there's localized blood flow compromise. The physical pinching of stomach tissue by the diaphragm restricts normal blood circulation, causing tissue swelling and congestion in that exact spot. Third, that already compromised, swollen tissue becomes extremely vulnerable to acid damage. Normal stomach acid that the tissue would usually tolerate now causes erosions and ulceration. Here's what makes this dangerous. It rarely causes pain, and it almost never causes visible vomiting of blood. The bleeding is slow, continuous, and completely silent. Over weeks and months, this gradual blood loss drains your body's iron reserves. The result is iron deficiency anemia with small, pale red blood cells showing up on routine blood work. Patients experience profound tiredness that doesn't improve with rest, along with paleness, heart palpitations, and breathlessness during mild exertion. If your doctor has found unexplained anemia and you also have a hiatal hernia, these two facts are very likely connected. 6. Acute gastric volvulus and Borchards triad. This symptom represents a genuine medical emergency, and recognizing it could save your life. Gastric volvulus means your stomach has rotated more than 180 degrees around itself. This happens when the ligaments that normally anchor your stomach in place become stretched and lax. Large paraesophageal hernias create exactly the conditions needed for this dangerous rotation to occur. There are 2 patterns this rotation can take. Organoaxial volvulus is the more common type, accounting for roughly 60% of cases, where the stomach flips upside down along its long axis. Mesenteroaxial volvulus is less common, making up about 30% of cases, involving rotation along a different axis that blocks both ends of the stomach simultaneously. Either way, the result is a closed loop with no way for contents to enter or exit. This emergency presents with a very specific, recognizable combination of 3 symptoms doctors call Borchards triad. It appears in up to 70% of acute cases, making it remarkably consistent. The first sign is sudden, severe pain in the upper abdomen or lower chest, caused by the violent twisting and resulting tissue ischemia. The second is intense retching without actually being able to vomit, because the twisted anatomy physically blocks the exit. The third sign is the most telling for medical professionals. Doctors cannot pass a nasogastric tube into the stomach. The twist creates a mechanical block that the tube simply cannot get past. As the trapped stomach continues filling with fluid and air, it expands rapidly inside the chest. This expansion can press against the heart and major veins, potentially causing sudden cardiovascular collapse. Without immediate surgery, acute gastric volvulus carries a mortality rate between 15% and 50%. Sudden severe abdominal pain combined with an inability to vomit is never something to wait out at home. 7. Incarceration, strangulation, and ischemic gastric perforation. This final symptom represents the absolute worst-case progression of an untreated hiatal hernia. It's the sequence of events that makes early diagnosis and treatment so critical. Incarceration happens when herniated stomach tissue becomes physically trapped in the chest and can no longer slide back down into the abdomen. The rigid diaphragmatic opening essentially acts like a tight collar around the trapped tissue. Once trapped, the stomach keeps doing what stomachs do, producing digestive juices and collecting swallowed air. With no way to release that pressure, it builds steadily inside the confined space. As pressure rises, it first overwhelms the low-pressure venous system responsible for draining blood out of that tissue. Blood backs up, causing swelling, congestion, and worsening tissue stress. If nothing intervenes at this stage, pressure eventually climbs high enough to block arterial blood flow into the tissue entirely. This is strangulation, and it cuts off all oxygen supply to that section of stomach. Without blood flow, tissue dies rapidly. This is called necrosis, and dying gastric tissue doesn't stay intact for long. The natural next step is perforation, where the weakened, dead tissue simply tears open. This releases stomach acid, food, and bacteria directly into spaces of your body that are normally completely sterile. The chest cavity and the area around your heart become flooded with contaminated material. This triggers fulminant infection throughout the chest, a condition that escalates extremely quickly and is genuinely life-threatening. This cascades into septic shock, where your body's organs begin failing from the overwhelming infection and inflammatory response. Multiple organ systems can shut down within a short period. Separately, a massively swollen, trapped stomach can also directly compress the heart, causing a different kind of shock from impaired blood circulation alone. This is precisely why doctors treat any sign of incarceration, instability, or suspected tissue death as an immediate surgical emergency, with no time for a wait-and-see approach. If any of these 7 symptoms sound familiar, please don't dismiss them as ordinary digestive discomfort. Talk to a doctor about proper imaging and evaluation, because catching a hiatal hernia early changes everything about how manageable it is. Give this a like, share with friends, and subscribe for more health tips made simple.